Lung cancer remains one of the leading causes of cancer deaths, but new technology is changing how it's diagnosed and treated. Joining us now is Dr. Shanna Elston from ProMedica to talk about a new robotic procedure. You're kind of doing two things at the same time, which is really nice.
Yes, exactly.
Yeah, so let's start with, okay, there's two parts, and one of it has to do with single anesthesia.
Yes.
And then there's a robot.
Yes, two robots actually.
Robots, right.
So what we're doing is we're trying to change the patient's experience to bring two different separate procedures traditionally, where you'd have anesthesia, be asleep, go through a robotic bronchoscopy, where you actually get diagnosed with a lung cancer or ruled out a lung cancer. But then if it is lung cancer, eliminating that extra time to wait and then go through anesthesia again and have a robotic lung resection. So this new procedure, what we were able to do in this patient who was a great candidate, was to be able to combine both. The patient went to sleep, we went in with a robotic bronchoscopy, we were able to mark where their cancer was, and then the surgeon was able to go in with his robot and resect the lung cancer.
Oh.
So the idea is you wake up and you find out, yes, you did have cancer, but the good news is it's been taken care of.
My goodness. Okay,
Yes.
that's really something because, yeah, there's so much of this like waiting period where you're like, well, I have to go in and then I have to have this done and then they have to tell me, yes, you do have cancer. And then you have to sit on it for however long before you can go in and take care of it. So that's really something. Is it like a long procedure then? Are they under for a while?
The bronchoscopy portion is short.
Okay.
The robotic lung resection can be a little bit longer, and that's, you know, every surgeon, everybody's body is different, so that time frame can kind of vary from individuals.
I would imagine it's also better for the patient recovery-wise as well, to not have to go under 2 times?
Yeah, absolutely. It eliminates that second need to come in for other testing and treatment, that need for the anesthetics, which anybody who's ever been through a surgery and had general anesthesia knows that there's a lot of pre-op assessment for that. So it eliminates all that travel, that need for testing. So recovery time, and essentially the main focus is that time of diagnosis to cure. That's what's shortened.
Yeah, which is great because I would imagine that if you get that cancer diagnosis, you're just like, get it out. Like, what do we got to do something now? It seems like time is of the essence. And
Absolutely.
In this case, time,
is absolutely of the essence.
Yeah.
So
what makes somebody a candidate for this? I imagine maybe you don't do this with every patient.
Absolutely. So the individual who might be considered for something like this would be someone who the surgeon felt like would be safe to undergo a lung resection. But also, if there's a high suspicion that this area is a cancer, then we can have a meeting of the minds with the surgeon and the pulmonologist that, yeah, this patient, it looks like it's probably going to be cancer. Let's go ahead and set them up and let's get this resected to try to move them, you know, through that journey as fast as possible.
Okay, so a case-by-case basis.
Absolutely,
though,
yeah.
Even still. So if somebody is maybe starting to feel symptoms of, would they be out of breath, or what kind of things would they start to feel if it could in fact be cancer?
Great question. The concerning part as a lung doctor is always that it's not symptomatic based all the time. So we really emphasize that if someone is a screening candidate for lung cancer screening CAT scans, that they really pursue that with their provider. And if they're not certain that they might be a candidate or their family member might be a candidate, really discuss with your healthcare provider if that's an option for them, because that's where again, time is of the essence to get that early diagnosis before symptoms start. Right. So pursuing that with your healthcare provider, getting those early screens so that we can diagnose this cancer and cure it.
Yeah, those prognosis could be much better.
Absolutely.
The earlier the better. So yeah,
absolutely.
See your doctor every year, get that physical, talk about your lifestyle and things like that, and then they can determine things from there.
Absolutely.
Very good. Well, this is really cool, what you guys are doing. So,
oh, thank you. Thank you. We think so, and we're very excited about it.
Very cool. Thanks for being here today.
Yes, thank you.
Appreciate it. Yep.